Good morning and welcome to Windsor-Essex County Health Unit's media briefing for Wednesday, October the 13th. We will start today's session with a few words from Nicole Dupuis, and then we will move into our media questions.
Thank you, Ashley, and good morning, everyone. Since the onset of the pandemic over a year and a half ago, staff at the Windsor-Essex Health Unit have worked respectfully and professionally to offer support and guidance for residents, businesses, and partnering agencies during the largest public health crisis of our lifetime. As public health professionals, as residents of this community, and as people, we understand the mental and emotional strain that the ongoing stress of this pandemic has had on all members of our community, including our staff at the WECHU. As the Chief Executive Officer and a member of this dedicated team, I could not be more grateful and proud of the compassion, responsiveness, and resilience that our team has shown every day in service to our community. Our team has worked nonstop to contain and manage the spread of COVID-19 in our community and to protect the health of all residents. This work has required redirection away from other important public health responsibilities for nearly every single member of our team, and this pandemic has persisted certainly far longer than any of us in the community had hoped for. We respect the rights of individuals to speak out and protest and to express their feelings about any actions or mandates that they do not agree with. We encourage public discourse and respectful exchange of information. However, it is not okay when this escalates to abusive, threatening, or violent behavior, and we must all stand out against this. The WECHU deplores any act of violence or threatening behavior towards another and supports the right of all workers to work in a safe work environment free from violence and harassment. It is important that we all take time to listen to and hear each other and respond with empathy and kindness. Please remember that the public health staff that you interact with are fulfilling their duties in service and the interests of the health of our community. Our staff are here to listen, to answer questions, to provide care and support. However, we will not respond to nor tolerate harassing or threatening actions towards our staff. The stressors brought on by this pandemic are significant and real. The impact of the pandemic has caused a wide spectrum of feelings, including fear, anxiety, frustration, and anger. At any time, if you are finding it difficult to cope with the pandemic-related stress, there are a number of resources on our website and through our partners like CMHA, Canadian Mental Health Association, Windsor-Essex, that may be able to help. Our team works hard to provide support for mental health and substance use needs of our community and have maintained this important role throughout the pandemic. To access any content, go to the individuals and families section of our COVID-19 homepage at wechu.org/CV. We are truly in this together. Please remember to care for one another, to listen, and to respond with kindness. Thank you for your time. We'll go to questions now.
Thank you, Nicole. We will take questions from CBC.
Yes, good morning. Nicole, was there any specific incident that prompted your comments this morning?
We have over the past few weeks. So throughout the pandemic, certainly the health unit has been a bit under a microscope, and we've always responded to comments, frustrations, feelings of anger. But over the past few weeks, we've noticed an escalation in the level of sort of language, and it's crossed the line at times to threats and abuse, and sometimes threats of physical violence towards our staff. And so, you know, I know Dr. Mehta spoke about it in the past, and just felt it was important to remind the community that there are people. These are people doing their jobs. They're doing their best for the community, and you know, abuse and violence and threats are not appropriate.
Well, I'm very sorry to hear that, and thank you very much for that. On a totally different note, Dr. Nezaturi, I'm wondering what your thoughts are about the border reopening next month, and what's your advice for anyone looking to travel across the border for non-essential reasons?
You know, I think at this point we should wait and see exactly what the guidance from the border authorities are related to travel. as always, we recommend for people to follow the general public health rules, which is to maintain social distancing, wear a mask when you're indoors, to wear a mask if you can't consistently and reliably stay 2 meters away from somebody else, to get vaccinated. Those are all important public health measures, but I've not seen any specific guidance from the U.S. border authorities, and once we get that information, I can comment further.
Thank you very much.
Any questions from Blackburn?
Yes, I too am really saddened to hear about that, Nicole, and we've certainly in the media have seen those comments on our pages directed at the health unit. It's distressing. I wanted to ask you if the police have been involved in any of these incidents.
So on occasion, incidents have escalated where police have had to be called, yes.
Has there been any injuries or just a threat at this point?
No. I mean, well, injury is a physical injury. No, injury is a interesting term. I would say certainly, personal attacks and language that's abusive or threatening is injures, just in a different way. But no physical injuries. No.
Mainly online or face to face?
So as I think that probably the media and community is aware, we've had. We're out in the community. We have vaccination clinics out in the community. We've had many protests at our vaccination clinics. And so, this has been both online, virtually, and in person. We've actually, as an organization, it's something that was a hard decision for us to do, but we've closed comments on our social media, and it was a way for us to engage with the public and to answer questions. But the language has escalated to a point where we had to make a decision to close that down.
Well, I hear you. We had to do that too. Thank you very much.
Any questions from Windsor Star?
Yes, Nicole, just going off of what Adele asked, to the tobacco and vaping enforcement officers who are going into the community and enforcing the changes in rules, do they receive this kind of response, threats, etc., when they go out?
Absolutely. They have a very difficult job, and they're not always met with kindness. At times, significant aggression. They are well trained in, as I said, they support our community. They support our community businesses and de-escalation tactics. There are feelings of frustration and anger, and those get expressed in different ways. And that is part of the role, but to help communities deal with that. But they are not always met with kindness, and sometimes it escalates to very concerning behavior towards them, threats, and they're certainly advised to not engage in those circumstances. There are times where we do partner with police, depending on the setting that we're going into, just from a safety perspective.
Thank you.
Any questions from AM 800?
Nicole, I'm not sure if you can get into this, but have you had staff members that have asked to maybe take a leave because of what's going on?
Yeah, I wouldn't comment on that specifically, but again, today is just a reminder of, a reminder to residents that, these are individuals. Our staff are doing their jobs. They're doing the best for our community. They're happily here to answer questions and to listen and provide support and care. But we just the sort of abuse, any abuse or threatening or violent behavior or language won't be tolerated, won't be responded to. We will be adding clearer language on our website as well, just for anyone who is emailing us or contacting us to be aware that if be mindful of their language and ensure that they'll get a respectful response.
Thank you. Doctor, switching gears, just in regards to our COVID cases, yesterday, since Friday, I guess there was 110 cases reported over, I guess, a 4-day span. Back after Labor Day, there was 304 cases reported. Is it safe to say, and I know we see the summary on Thursdays, but it seems like Windsor-Essex is making some progress here.
Right. I guess my first comment, thank you for the question. My first comment would be that no one data element in itself captures the full burden of COVID-19. I think taken together, the burden of disease is less now than it was in previous weeks. And I think that's something that we can be cautiously optimistic about. And I think we should just continue to monitor the situation related to burden of disease. The one thing I think we should also consider is that Windsor-Essex has, although the burden of disease overall in the province has decreased as well, Windsor-Essex still remains in the top, probably 1, 2, 3, 4, depending on what metric you use, of burden of disease of COVID-19. And it's been disproportionately affected by the burden to the community as it relates to economic activity and social activity. The schools were closed for longer periods of time in Windsor-Essex. There were additional public health restrictions to try to manage COVID-19. So I think that the burden of illness when compared to other parts of the province still remains high in Windsor-Essex. Vaccination is a key part of the management of COVID-19 and trying to bring it under a more under better control. When compared to other health districts, the vaccination rate in Windsor-Essex is probably in the bottom third of all health districts in the province. So overall, I think that the health district has better control of COVID-19, but it is still a significant burden to the health of the community. The other thing I'd like to share, and this is important, is that I think as of today, I'm going to give you the exact number, about 260 cohorts, meaning 260 classes of students in schools, public school, high school, or in daycare centers have been dismissed because of COVID exposure. So there are more COVID exposures at schools in this short part of the academic year, from September till now, than all semester in the previous year. And so the burden of illness among young people remains still a challenge moving forward. Again, my apologies for being long-winded on this, but I hope that provides context.
Thank you.
Any questions from CTV?
Yes, good morning. Is there anything specific that prompted the threats against the health unit? For example, were they angry about vaccinations, restrictions, or was it more in general?
Well, I'd say that you addressed two of the major, I would say probably two major pieces that have increased or escalated, feelings, frustration and anger directed towards staff. Definitely vaccinations, public health measures and restrictions, whether they're our measures or the provincial measures. Locally, we are the face of those. So those are two, key, I think, key issues that are causing anger and frustration. However, we've seen, even in when we're communicating about other public health initiatives like healthy eating and nutrition, threatening comments made towards our staff. So it's a little, it has escalated to a point. And again, certainly we support public discourse. Certainly we want it, people are free to express, their feelings, ask questions, and but we do ask that that's respectful and professional, and remember that there are people on the other side, and these are people that are doing their job, and it's, our duty, my duty, to ensure that they're able to do that job in an environment that, that they feel safe and that's free of harassment and violence. And so again, we'll be, putting more specific information on our website, but also taking additional measures to ensure that, we just won't be responding to that type of communication.
Thank you. And you said on occasion police had to be involved. Were there any charges based on the threats?
I wouldn't be able to comment on that.
Okay, no problem. Thank you.
Any follow-up questions from CBC?
Yes, I do have a couple of more questions. With regards to the outbreaks that are currently affecting shelters, how is that going? I know there was some testing going on for those experiencing homelessness. Are there many cases right now, and do you have a sense of how many people are in isolation?
So Nicole, maybe you could start and I can supplement that.
Yeah, so we actually, I think, prepared for the worst and got, I think, a better scenario. So we have, as per our outbreak protocols and procedures, done ongoing testing, and I don't have the exact number of cases at this point in time or the number of individuals, so we can get more information for you as far as how many are isolating, but we haven't, I think everyone remembers our outbreak last year, and we haven't seen, a huge number of positive cases out of our testing, which is good news.
And if I could just share, an outbreak, every outbreak is different, and we use certain principles of epidemiology and field epidemiology to manage outbreaks. But one of the things we always consider at the Public Health Service when there's an outbreak is what's the consequences of widespread disease in that community. People who experience homelessness or people who use services like homeless shelters many times are vulnerable, and if they get infected, they're probably likely to disproportionately suffer from the effects of COVID-19. So we're particularly cautious at the Public Health Service when there are signals to suggest it might be a disease spread in homeless shelters and other areas where vulnerable people might reside. The second issue is that one of the main treatments or the main approaches to manage outbreaks is self-isolation, to separate those individuals who have been exposed or infected from the general community for a period of time. Self-isolation residences are challenging to obtain for people who don't currently have a home. And so that is something that we have to really be vigilant about and be sure as a community that if there are outbreaks among the homeless community or other people who don't have permanent residences, that we are able to locate and identify comfortable self-isolation residences.
Thank you very much. Since we last spoke, we've reached 20,000 total cases since the pandemic began, and we also now have 300,000 people who are fully vaccinated. I'm wondering if either of you have any reflections to share on those very different milestones in the pandemic.
Well, I think that clearly, I think that the community, there's not a single person or family or household or institution or school that's not been affected by COVID-19. I think that when the history of this pandemic is written, this is probably one of the most consequential events of our lifetimes, or at least it would be one of the most consequential events of my lifetime. At this point, vaccination is one of the key approaches to trying to contain COVID-19, and the higher the population of people, or the higher the percentage of people that are vaccinated, the more likely that we can reduce other public health measures. And so I think there is a relationship between more people vaccinated and less public health measures beyond vaccination. That being said, there are approximately 60,000 people in the health district, that's our latest estimate, who are eligible for vaccine who have not been vaccinated. We also know that vaccination rates among young people in schools is lower than we might hope for. And we also face this challenge that at the current time, young people under the age of 12 are ineligible for vaccination. So I think we still have some ways to go to try to bring COVID-19 under better control. And I think these numbers are an opportunity for us to reflect on what the past experience has been including the number of people who have died, and also think of how we can move forward to try to have better control.
Thanks very much.
Any additional questions from Blackburn?
Just one, just to clarify a detail. When did you guys shut down the commenting on your webpage, your social media?
I don't have the exact date. Our communications team would know best. I think it was last week.
Okay.
Mike or Ashley or Eric may be able to respond for the exact time.
All right. Okay, thank you. That actually does help quite a bit. And that's it from me. Thank you very much.
Any follow-up questions from Windsor Star?
Yes, Nicole, you took the role as CEO about 3 or 4 months ago. Have you received direct threats in your time since taking the helm?
There are a lot of, I would say, not direct threats to my physical person, but certainly a lot of angry messages directed towards me. And over the course of this entire pandemic and my role as CEO and the previous role as director, I've spoken to hundreds of community members, and many very pleasant and some not so pleasant. And again, frustration is certainly something we understand and are here to listen and respond to, but it's just that escalation to threats and then abusiveness that we all need to be mindful of, and we should not tolerate in our community. I think we should all stand against that.
And doctor, in your time as acting medical officer of health, have you been a recipient of the vitriol from the Windsor-Essex community? A small group of them, but vitriol nonetheless.
As a public health official, we anticipate that people will express views that are contrary to current public health guidance, or are dissatisfied or otherwise have reservations about public health policy. In general, and historically, the Public Health Service has been receptive and continues to be receptive to hearing different perspectives as it relates to public health management. And we accept there should be we accept and in many ways encourage a level of healthy skepticism of public health guidance. And so that's part of what we do every day. I think at this point in the pandemic, we've had a number of individuals who have articulated their perspectives and crossed the line from civil discourse into threatening, abusive, or disrespectful commentary. And in some cases, that commentary has included implied or explicit threats. And I think that I think is a thing that we really have to work to address. It's not the healthy disagreement or skepticism that we're concerned about. We're concerned about the implicit or explicit threats. So I guess that would be a key item for us moving forward. I'd also share this at a personal level. The management of the pandemic, the Public Health Service can and continues to guide the community on the correct group of measures or the appropriate measures given the facts and circumstances. But really, to effectuate that plan, that requires the cooperation, affirmation, and adherence of every community member. I would ask those people who have differences in perspectives with the Public Health Service to reflect on how they construct their communications and dialogue, so that it merely reflects their area of disagreement and doesn't cross over to personal attacks or items that could be considered personally adverse to the people receiving them. And I would ask that they do that just like they do for any other dialogue that they have with the community. So that's my one ask, is to think about when you write something or when you phone or when you email or comment about how the recipient might perceive that. At the end of the day, many of the people in the public health service are just trying to do their job as best they can to serve the community, and they should not be exposed to aggressive or assertive or abusive conduct. Nicole, I hope that that encapsulates, I think, what our main points are today.
Yes, it does. Thank you.
Thank you both.
Any follow-up questions from AM 800?
Sorry, Nicole, one quick one. The escalation, I know you touched on it in your opening remarks, how Dr. Ahmed touched on it, how it's been happening since the pandemic. But has the health unit been seeing the escalation ever since the vaccination certification program was launched?
Anytime there's new changes and mandates or public health measures, we do see an increase in, communication and public discourse, which is, as Dr. Necessary said, expected. And it's really, in the past few weeks, in particular, related to, vaccination and some of the public health measures that we're seeing, it's increased significantly. And the level of discourse and the way in which, individuals may be expressing those feelings in a threatening or abusive manner, we've seen that increase over the past few weeks.
Thanks, Nicole.
And finally, any remaining questions from CTV?
No, thank you. Have a good day.
All right. Thank you, everybody. Have a wonderful Wednesday, and we will be back tomorrow morning with our EPI summary as well.
All right. All the best.
Thank you all.
Bye-bye.
Have a great day.